I'm a 58-year-old male diagnosed with colon cancer. It was stage 2. I had a colonoscopy in 2021, had my surgery. Dr. Charles was my surgeon. They did a laparoscopic surgery on me, removed part of my intestine. Now I'm cancer-free, and I thank him for that. Dr. Charles is a great guy. He's been very supportive, very detailed, made sure I was comfortable, did everything in his power to make sure I was okay.
I met Dana when he had just completed his colonoscopy. He has a family history of colon cancer, and anybody with a family history should really get colonoscopies every 5 years. He did get his first one, which was great, but then delayed the second one. Unfortunately, they found 2 polyps that were easily removed, but there was a third mass, really, in part of his colon, and so he was then referred to me as the part of the surgical team to take a look at him and help treat that. We spoke in the office about what the options were for treatment of colon cancer that's not spread to another organ. The primary first-line treatment is surgery. So he went through surgery. That went really well, successful. Thankfully, when his pathology came back from surgery, he didn't have any lymph nodes that were positive. It's 3 years out now. I see him, every 3 to 6 months. We get routine blood work. That's always been normal. Every year we get a CAT scan, and he's had his updated colonoscopies, and thankfully everything looks clean and everything looks great. But what's cool about Dana is that he totally revolutionized his life. This was sort of a typical dude just going to work and doing his thing. He had some hypertension, diabetes, etc. And I remember seeing him the year after the surgery, and I was like, you can't be the same person. He bought like a home gym. He's been lifting, he's muscular now, dropped a bunch of weight, fit, looks great, totally revolutionized his life. I think he went vegan even, which there's some evidence to say that less red meat and stuff is actually beneficial for cancer risk. So this wasn't just, hey, I'm doing surgery and going back to my normal life. He totally revolutionized everything, and is an outstanding patient.
It's important to get your colonoscopy screening test because it's a matter of life and death. It's a genetic trait. I have 2 sons, and African American is higher, so I stay on them. I'll tell them, son, you need to go get this checked out. Your grandmother was diagnosed with colon cancer. I was diagnosed with colon cancer. It's a good chance that you are. The sooner the better. When you're 40 years old, African American male, plus you have a family history, those are three of the risk factors. So do it as soon as possible. Prevent is key. Is very important. I couldn't stress it enough.
For average risk patients, meaning no family history, no prior polyp in the past, you start screening at 45. Now that's a change in the last, let's say, 3 to 5 years or so. It used to be 50, but we're seeing younger and younger people with the disease, and so there's been general consensus that the age should be moved to 45. So now we start at 45. If at that first scope you have no polyps, in general, we say come back in 10 years, unless you have change in symptoms between that time frame. If you do have 1 to 2 polyps, then we tell you to come back in 5 years. 3 and more, we generally say come back in 3 years for that. So that's the general screening protocol for patients with polyps and colonoscopies. If you have a parent or a sibling who's had a history of cancer, you want to get your screening started 10 years earlier than when that family member was diagnosed. So if they had cancer at 50, you want to start at 40. If they had it at 48, 38. If you go 10 years earlier than the sibling or parent who had the cancer.